my experience with my clinical rotations. So I'm going to be talking about my experience with a hospital, an outpatient clinic, and also a skilled nursing facility. So stay tuned. I'm going to be talking about the hours, documentation, and the caseload, and the pros and cons of each. So the first place I went to was a hospital, which with my experience, I did not have the best CI, but I'm just going to kind of go over the pros and cons of each thing that I kind of did, and I kind of wrote it down on a little list again so I can stay sort of organized. But kind of the pros of the hospital was that it was very fast-paced. The hours were nice, lots of bed mobility, lots of patient care. Some cons that I didn't like were that you had very complicated patients, which required you to do a lot of chart review because you didn't want to do anything that would harm your patients. So you really had to look through that because they're very complicated patients. Also that you do a lot of toileting, a lot of cleaning up, a lot of CNA work kind of as a PTA in a hospital to just get your job done basically. So the hours that I had were from 8 a.m. to 3:30 p.m., which was a really good day. That's pretty good hours. In the documentation, you do daily notes on every patient, and it usually takes around 5 to 10 minutes on each patient. Depending on if they have any complications, it could take longer, but it was usually around 5 to 10 patients for each patient. And the caseload was usually around 10 to 15 patients per day, and sometimes we were only in there for 15 minutes to 30 minutes, about sometimes 45, but that was pretty rare per patient. So that's kind of what it was like at the hospital. This was my least favorite rotation. It was my 4-week rotation, so I wasn't there for too long, but I also have a student in my class that is actually working in a hospital, and she loves it. So it kind of depends on your personality. For me, the personality type there that it seemed like was kind of more of a type A, very detail-oriented type of person. So I don't know if every hospital is like that, but that was kind of my experience with the hospital. So if you're more looking towards, if you love patient care and skills and you love bed mobility and you love hospital things, maybe if you've thought about being a nurse too, this would be a great rotation for you, is the hospital. But for me, it wasn't what I wanted to do. So hopefully that gives you kind of an insight on what a hospital is sort of like. Just to give you an example, obviously everywhere is different, but this is my experience. So the second place that I went to was an outpatient clinic. And the pros with this is that I had a great CI. Me and my CI really got along very well. He was a football coach, and I love sports, he loves sports, so we kind of clicked. He was an older guy, and he was just funny, and he was really nice. So obviously you're dealing with more sports-related injuries or injuries that happen from a fall, a lot of rotator cuff injuries, knees, ankles, things like that. It's very fast-paced, and you have lots of variety in age at the outpatient clinic, which is kind of fun. You get all sorts of people. Some cons, you don't get to know your patients as well because you're not with them as long as you would be with maybe somebody in a skilled nursing facility, which I'll talk to you about a little later. The hours were kind of long days because my CI had 4 days, 10 hours. So it was 4 10-hour days, which was fine. It was actually really nice having Wednesdays off, but at the same time, it was just really long days, especially because he was kind of far away from me, so the drive and everything with that was just one of the cons. I loved outpatient. Overall, it was a wonderful, great experience. I can't really complain at all. It was awesome. The hours for outpatient was usually from 7:30 a.m. to 6:30 p.m., 4 days a week. Documentation, you did daily notes on patients, which took about 5 to 10 minutes for each patient. And then you had around 9 to 16 patients per day, depending on the caseload and kind of how many patients you have that week. And then you usually have 30 minutes with them at a time. So the next place, the last place, and I was at the outpatient clinic for 6 weeks, so that was awesome. They all threw a party for me after, which was just really sweet, and everyone there was super friendly and nice, and kind of more of my personality, more kind of type B kind of individual is who I worked with at that clinic. Although I've heard of other clinics not being like that, so it kind of just depends again. The third place that I went to was a skilled nursing facility. So the pros with this that I came up with was that I had a great CI at this rotation as well. He was super cool. He had graduated like 4 years ago, so he kind of knew what it was like to be a student, which was really nice. And then it was a great balance between patient care and exercises, and it was kind of a good mixture of what you would see at a hospital and outpatient. So you did some bed mobility and things, but they were more high functioning, so it wasn't like you were doing all of the work like it was like at a hospital. And then you really get to know your patients in this facility, because you're with them usually for an hour. Sometimes it goes from 30 minutes to 75 minutes. So you really get to know your patients, which is what I like about the skilled nursing facility. And then cons that I came up with was that the notes are really long. We had progress notes that we had about 7 different sections, and you had to write paragraphs about this long on each one. And it's not like that everywhere again, but at that facility I was at, it was just a lot of writing. And then you get to make your own schedule, which is awesome, which I put as a con, but that's actually a really good thing. I don't know why I put that as a con. It's a pro to make your own schedule. The hours for this facility was from 9 a.m. to 5:30 p.m., which was a great schedule. I had to drive a long time for this, usually an hour to get to work, so it was nice having it at 9 a.m. instead of 8 a.m. So I had to get up extra early. For the documentation for this, you had progress notes and also discharge notes, which take a long time, especially depending on how long the patient was there. If the patient was there for a longer period of time, then the progress note or discharge note, or the discharge note would be taking a lot more time, because if you're there longer, then you have a lot more things to combine, and you'll see when you get there. All right, and then the caseload was usually 6 to 9 patients, so you actually had less patients per day than the other facilities that I did, at least. And that was awesome, because you get to spend more time with your patients and you really get to know them, like I said before. And usually you see them for about 30 to 75 minutes. Usually around an hour, I feel like, was the kind of average of how long I spent with patients. So I kind of get to know them, get to know their background, and it was really fun for me because I like talking to people. And so that was probably, I want to say the SNF was my favorite, skilled nursing facility was my favorite. But I also really liked outpatient. I could work at either of those places and be really happy with my career. And anyway, I'm really grateful for the clinical experience, because this is kind of where I gained my confidence. School kind of tore my confidence down a little bit, and so it was good to have a mentor and to have somebody there that kind of teaches you the ropes instead of you being tested on everything. And again, it totally depends on your clinical instructor. I've heard nightmare stories. Luckily, I got pretty lucky with all of my clinical instructors, but it kind of depends. The wind is now telling me I think that I need to go. If you have any questions, definitely either drop a comment down below or send me a direct message on like my Instagram. It's usually listed down in the description. And then also, if it helped you, like this video and subscribe if you want to see more PTA videos. This tends to be, if you haven't seen my video on how to get into PTA school, definitely go check that out as well. But yeah, I think that is everything that I want to share. If you guys have any questions, please don't hesitate to let me know. I'm pretty good with responding back. Or if you maybe are hesitant about PTA school and need a little like pick me up of like you should do this, then definitely contact me. All right, you guys keep smiling. I will talk to y'all later. See ya.